Hi, my name's Taylor. I'm doing a video to demonstrate how to do a short arm cast. For the sake of this video, I am using a 3-inch soft cast. If I was doing a short arm cast in Fracture Clinic, I would be using fiberglass and the application of water to help it set. But for the purpose of today and to take it off immediately after the video, we're just using soft cast. So the first thing I would do when applying a cast is measure up a 2-inch stockinette and place that on my patient's arm. We use stockinette because it's a hypoallergenic material and it'll decrease any risk of skin reactions to the Weberil or fiberglass. When applying the stockinette, you want to make sure it's as smooth as possible, coming down to the elbow and up to the hands, up to the fingers, sorry. We're then going to cut a small hole incision so the thumb can go through. That just means that there's as minimal skin outside the stockinette as possible. So that's looking all smooth. I've then cut a 1-inch stockinette for the thumb as well. So I'm just going to apply that now. All right, making sure that they're smooth and that there's no exposed skin. I'm then going to make a small fold down around the thumb, fingers and elbow to make it easier for when I'm putting the fiberglass on. Alright, now that that is on and making sure that that's as smooth as possible, we don't want any wrinkles because that will increase any risk of pressure injury when the cast is on. We can then go ahead and apply our 3-inch Weberil. When applying Weberil, you want to try and keep it as smooth as possible. That's again going to help with any risk of pressure injury while the fiberglass is on. We like to do 2 layers of Weberil to ensure the best pressure care possible. More layers of Weberil doesn't necessarily mean better pressure care. It can actually just mean that the fiberglass will move when the cast is on, which means it won't be immobilizing the fracture as we would like. We want to try and make the Weberil go where the fiberglass will, maybe a little bit higher. We don't want the fiberglass to go over the Weberil because again it increases a risk of a pressure injury from the fiberglass itself. Once the hand is done, we make our way down the arm. Trying to make it firm but not tight. And ensuring it's smooth the whole way down. Prior to starting a cast for my patient, I would talk them through the procedure quite quickly, gain their consent, and talk them through the initial warnings. For fiberglass, it's important to let your patient know initially that it can be quite warm and it can be warm for up to 20 minutes, just so that they know that that's a normal sensation. Once the Weberil is applied, I'll ask my patient to put their hand in a stop position with a slight wrist extension, making sure that their thumb is in line with their lateral elbow prominence. That's just a neutral position that is standard practice for a short arm cast. If the surgeon or the doctor wanted a different position, we would adjust as needed. We're doing an anchor for the wrist prior to doing the hand, just to keep it in place. We're then coming up, ensuring that we don't go over the Weberil making a small cut. Bobby, I'll just get you to splay your thumb out for me a little bit. Alright, it's at this point that I am folding down my stockinette. And then your second layer of fiberglass can go over and lock that off. And just slaying your thumb out for me, Bobby. Alright, once there are 2 layers of fiberglass on the hand, we can go around making sure we lock off the base of the thumb here, and then we can make our way down the arm, ensuring not to traction the fiberglass. We don't want it to be too tight. It's important to consider that we're not tractioning in it, because that increases the risk of increased pressure under the cast, which is one of the warnings that I would be giving my patient after applying the short arm cast. Alright, once I get down to the web roll at the base, I am going to fold up the stockinette. Trying to make it as smooth as possible, and then we're just going to make our way back up the arm to ensure that there are 2 layers of fiberglass over the whole arm. Some people wet the fiberglass prior to applying the short arm cast. As this is soft cast, I haven't done that. Alright, and we've got quite a fair amount of soft arm cast, or what would be fiberglass, so I am just going to cut it off. At this stage, if it was a patient in fracture clinic, I would be dipping my hands in water and rubbing it over. That's going to help set the cast. I would also be doing small little bits of pressure in the base of the hand. That's just going to help mold the cast into the patient's hand. I would make sure that the patient can move their fingers like this, move their thumb, and that from the elbow crease there's approximately 3 fingers. I would ask the patient if the cast is comfortable and if they can splay their hands, ensuring that there's enough room in the cast and that there's a low risk of pressure injury. I can see on this cast that I've got a few little bits here. I can file or cut them off once the cast is set to decrease risk of any little cuts on the fingers or hands.
Maybe also.
Yeah. All right, that's not setting because it's soft cast, but you can imagine. As this is setting, I would just go through all of the warnings with the patient, and I would also go through everything they can and cannot do. And that is my short arm cast.